Park Community Health Centre, in partnership with St. Michael's Hospital and Fred Victor at their 40 Oak Street location in Regent Park, are having pop-up testing for COVID-19. And we've been doing this to make sure that members of the Regent Park and Moss Park communities have access to testing. The rates are, they're not out of control, but they're at a level where we really want to make sure that community members in Regent and Moss Park are getting access. So that's really our focus. This is our third pop-up. We've done 3 in January, so this is our last in January. We were just piloting it. We're hoping to get more numbers because we're going to be here every Wednesday in February from 1:30 to 4. We'll be here at 40 Oak to do testing, and we have the capacity for way more than 20 people. We're hoping that we can be doing tests for 50 to 60 people on each day that we're here.
We realize the community transmission is playing a big part in the spread of COVID-19. Unity Health reached out to us with Regent Park Community Health to set up testing out of this location. It's a big space. It made sense. There's an in and out exit entrance of the door here. It's an open, clean space. And we wanted to do anything we could to help in this trying time right now. It's been really challenging over the last year. Hopefully in the future, potentially even having vaccines out of a location like this would be an ideal scenario for us.
We've been tested before, but in the summer. So, since the summer we've been around some people. We just want to take the precautions.
We might have been in contact with someone that might have had COVID.
So we want to be safe than sorry. So we're coming to get tested. And then if it's positive, we'll isolate.
I'm afraid.
She's scared. I'm excited. I'm doing it. Stay home, stay away from crowded areas, and wash our hands and sanitize, and oh yeah.
The eligibility criteria for our pop-up testing is if people are feeling ill, if they've had contact with someone who has COVID, they can come here to get a test. The one thing is they need to bring a piece of ID. It doesn't have to be their health card, that would be great, but a driver's license, but anything with a piece of ID is really important. The testing is free. It's important that people know that we're following the provincial guidelines right now, so people who are being tested here, to be eligible, you have to have symptoms or have had contact with someone who is COVID positive. Within 2 days, people should know, and it's important people remember they'll only get a call if they're positive, if they have a positive result. If they have a negative result, they won't get a call. We have long-standing partnerships with both St. Michael's Hospital and Fred Victor. We've worked very, very closely with both organizations for many years on many community-based initiatives. And so this was really kind of easy to come together because we're such great partners in so many ways and have been for so many years. So it's always a pleasure to be able to work with our community partners.
We are seeing, I guess, like a steady percentage of positive cases. I know that certain communities in Toronto are a bit harder hit with COVID positive rates. So I think it's just a good thing that we're here in Regent Park to offer as much testing as possible so that we can catch any cases.
Well, the numbers are recently starting to dip a bit, but they're still really high. If we look back in March, when we were reporting about 200 to 300 cases a day, people were taking it very seriously. There were a lot of question marks about what this virus was going to do, how it was going to spread. There's still a lot of questions about that.
There's always the chance that people could become severely ill, but there are many lucky people who have been infected with COVID who've recovered just fine and they felt okay. We have seen a large reduction in flu cases this year, and I think that is in no small part due to our efforts to combat COVID-19 and all the measures people are taking. It's including wearing masks and personal protective equipment and keeping our hands clean. It's the best way to fight disease. So we are seeing a lot of people coming through with symptoms, and some of them end up testing negative for COVID, so it's possible they just have a cold.
We've struggled trying to figure out how we can best support the community. From the get-go, we've been serving meals out the front door. We usually have about 300 to 400 people sitting inside there in the drop-in daily getting meals. Since COVID, that hasn't been the case. So we've transitioned to takeaway meals right from the start. And right now we're seeing about 13 to 1,400 meals going out the door a week. So it's been busy and it's been stressful, but we're always trying to find ways to help the community. As I said, between December 22nd and December 31st, we've been switching more to a kind of a direct service model. We handed out 550 winter care packages. Going forward this year, we're going to open up the space to connecting with other community organizations so that they can meet with their clients in our space, because that's a barrier right now. A lot of people aren't getting the support they need directly. They have to rely either on Zoom calls. Technology is a barrier. Not everybody knows how to use it. Not everybody has access to it. So we're going to open up the space to other community agencies so that they can meet with their clients in this space. I think the community is seeing the value of the space even more right now. It's for certain people in a society, it's never easy, even on the best days. Right now, it's been extremely difficult. So they see the value that we've remained open. We haven't closed our doors. We're still here. We're still trying to find ways, innovative ways to connect with people in the community. And I think it's appreciated by people. Our numbers haven't really changed. We see new faces that we did, prior to COVID. But, I think people see the value of what we're doing and what we're trying to do. And we're trying to push for better outcomes for people that access the space too. It's not just about numbers. It's about, actually doing something that benefits people and helps them.
Pop-up testing will be at 40 Oak, 4 Wednesdays in February from 1:30 to 4. We encourage anyone in the Regent Park or Moss Park communities, if you're feeling unwell, if you've been in contact, please come and get tested. You're more than welcome.
Please do not forget to like, comment, and share to our channel. Follow us on all our social media platforms. And for more information, please check out our website.